Now, the latest Menstrual Health survey results show the need for employers to embrace the need for a workplace policy on the issue. Well, I'm joined now on the line by Mandy La Combre. She's Senior Industrial Relations Officer with the FSU. Good afternoon, Mandy.
Good afternoon, Caoimhe. How are you?
Great, Mandy, and thank you very much for coming on with us today. Talk to us about the survey results and I suppose your findings.
Okay, well, first of all, I suppose just to give a bit of background, during the month of March this year to mark International Women's Day, FSU launched a workplace survey throughout our sector in the finance sector and tech sector on how menstrual health impacts work and life. Now, obviously, historically, menstruation and its effects have been largely ignored in the workplace, and, you know, that's obvious from some of our results. Despite the fact that we know that there are almost 50% female workforce in both Northern Ireland and the Republic of Ireland. Some progress has been made internationally in supporting needs of workers who suffer from symptoms related to menstrual health, but really, if we look at it in the round, there's been insufficient attention given to the importance of menstrual health to date in both Republic of Ireland and Northern Ireland. I mention both jurisdictions because our union is a cross-border union. We work through the whole of Ireland. Also, our concern would be that given that there are specific medical conditions associated with periods, such as, you know, endometriosis and PCOS that are impacting working women, unions are kind of standing up for workers around menstrual health and seeking support from employers to create a more comfortable workplace. And research, and including our own research, shows that taboos around menstrual issues are preventing those suffering from raising health problems associated with their periods with their line managers. And we know that there are obvious reasons why menstrual health in the workplace, you know, has not been seen as an important, probably, workplace agenda item. You know, social taboos and gender stereotyping have stigmatised periods in the workplace as something that should just not be discussed. And this stigma has also created, I suppose, a negative impact then on workers who may want to speak out about their issues in the workplace, but instead their problems are being ignored, not prioritised. And for us then, you know, when we were looking into this, there's a lack of research evidence on the impact of menstrual health in the workplace, and especially in Ireland. So FSU and other unions, so Forsa, have also, you know, collaborated as well. We have a campaign going called Stop the Stigma, and I'll talk to you a little bit about that later on. But we have surveyed our workers about, you know, trying to really change and get some information on how to change this and to prioritise the needs of women and trans women in the workplace more effectively. So the results of our survey, our own survey, I suppose, had about over 1,000 respondents, and interestingly enough, there was over 2,000 written comments. You know, so as part of that survey, there was a lot of input from our members that, you know, actually spoke about specific problems that they were having. But I suppose the headline and the highlights of the survey are 91% think menstrual health affects work and life. So that's, if you're a woman, you know, which you are, and I am, that's no surprise to us. 96% of respondents said that they would welcome a menstrual health support policy in the workplace, and almost half said that they're not comfortable at all talking about their issues in the workplace. And that is really down to, you know, the main reason, I suppose, being that the gender of their line manager, you know. So some very interesting stats. If you would like me to talk about some of the commentary maybe in the survey.
Please, I'd love to hear it, yeah.
Yeah, the most common actions, I suppose, that people sought for the union to kind of look into was really to try and get the employer to implement a menstrual health workplace policy. That was probably the number one thing. And then there was kind of issues around training for people managers, and particularly on the medical conditions that have painful menstrual symptoms, as I mentioned, endometriosis, PCOS, etc. And then an education and communication piece more generally for all staff, just on period stigma, and I suppose the culture around being able to speak up and talk about that type of stuff. You know, so that were kind of the main findings, you know.
Over 2,000 written comments. It goes to show the success of the survey because, you know, like I'm sure many people, when they take surveys, they just click, submit.
Yeah.
It takes a little bit of effort to write down how you feel about something.
It does. And, we have been surveying our female members in the union for a long time, right? So FSU would have been at the forefront of maybe a lot of the menopause workplace stuff as well. And, we did a menopause workplace survey a number of years ago where we had over 6,500 written comments in that. And that was like where we kind of really saw the impact that the women's health issue was having. And I suppose the menstrual health piece is just kind of widening out that, because we have a women's network as well at FSU, and we have about just over 100 female activists in the women's network, and we meet a couple of times a year. And at last November's meeting, it was actually at that women's network meeting where they kind of said to us, okay, well, FSU have done great work, securing workplace policies in all of the, large finance employers around menopause work. So, why can't we have them on menstrual health as well? And then when Forza contacted us around collaborating on the Stop the Stigma campaign, they're mostly a public service union, so they have predominantly female membership as well. We were like, okay, this is a great collaboration. We can start, looking at workplace policies and a wider, the Stop the Stigma campaign is around a wider awareness education piece, but as part of that, we really see the workplace policy piece as really being something that breaks the stigma. And, the stigma surrounding periods, as I said, is preventing people from discussing, issues in the workplace. But why it's important in the workplace really is, if it's ignored, if the worker doesn't get the support that they need, they're increasingly likely to have, some side effects of feeling ill, or maybe you might have increased absenteeism, which is a worry for us, because if those women who maybe suffer from particular health conditions are having, absenteeism every month, then that could trigger an attendance improvement plan, performance issues, etc. But having that locked into a policy where it's addressed really gives some support to workers. And, there are a number of, I suppose, really easy, I would say, things that employers can do in order to improve the workplace for both menstrual health and menopause. But we're talking about menstrual health here. But I mean, obviously the first one from our perspective would be to implement and communicate a good menstrual health workplace policy, which we have sample policies that we will be sharing with employers. And then, of course, training for managers on the medical conditions, and just, training in general on the period stigma, looking for some reasonable accommodation or possibly special leave for medical conditions that cause severe debilitating symptoms. We're not talking about paid leave every month for every woman who has a period in the workplace. We're talking about those women who have medical conditions that are really, really suffering. And then, options to work from home during a bad period. I mean, hybrid working is such a big thing now that, this should be a reasonable ask from an employer. And then just, things around additional rest breaks if needed, and just looking at the environmental supports, like making sure office temperature, desk fans, breathable uniform fabrics, things like that. We have free period products in most of the employments where we represent workers anyway now. So, I mean, this is just a step on that menstrual health piece as well.
And it's all good news, Mandy, and I don't think any woman listening in would disagree with anything found here. But I think the big one really for me, and I'd say for most women listening in, is, approaching maybe your line manager or your boss about an issue like this, especially if they are male, because, it's like anything in life. If you don't know what it's like, or you've never gone through it, you've often heard that thing where midwives, while women are in the throes of labour and are asked, have you had a child? And they say, yeah, because they can't really calm a woman down if they maybe haven't, gone through it themselves. And so it might be hard to implement within the workplace, because how do you, maybe people wouldn't understand.
Well, look, I think that the way has been paved in terms of doing and succeeding with menopause policies. I think that the menstrual health piece is actually a lot smaller and easier to complete than the menopause stuff was. Sorry, did I say menstrual health there? I meant menopause. We have already completed a lot of menopause work, so I think the menstrual health stuff is a kind of an addendum to that, and it's an easier piece to do. But you are completely right. One of the things that came out in the survey, and that our members would say to us all the time, is that approaching their line manager is the piece that they find difficult. And that is really why I suppose this breaking the stigma and changing the culture in the workplace is so important. But you have to remember as well, there are clear positives in this for employers too. For employer, there is a very, very clear financial benefit in adopting policies that consider the needs of their women employees, and particularly in order to retain experienced and valued staff. We're in a kind of a workplace environment now where workforces are job hopping and here and there. And things like these policies and things where it's an attractive employment, that's where people are running to. And, helping staff to manage their conditions and thereby reduce the likelihood of long-term sickness absence is obviously really good as well. Having a policy in place that deals with that is superb. And, employers acknowledging things like menstrual health and menopause, that's also, a stressor, can lead to mental health issues. This is all very positive for employers. There's benefits for them looking at this. And then there's the obvious ones as well to, help avoid potential discriminatory treatment. Nobody wants a case taken against them on the grounds of disability or equality issues.
Mandy, what I found interesting about the survey, though, 22% say periods are joked about in the workplace. Yeah. Were there any written comments about that, or what was the general feeling there?
Yeah, and the commentary around the periods that's being joked about in the workplace was similar to, the commentary that we had around jokes about menopause in the workplace. It was very, very similar. So it's like, if somebody's in a bad humour or a bad mood, that people will make a comment, oh, she has her period or something like that. So, it wasn't, actually slagging and sneering at people when they had their period. It was just, ad hoc comments, which aren't nice and are discriminatory and are not acceptable. And most employers will have, equality policies that would deal with all of this kind of stuff. But because it's period and because it's so stigmatised, people don't report it. They just don't. So they're kind of hiding away and discussing it amongst themselves, and telling us.
So I suppose, Mandy, in the future, we know certain European countries have brought in paid leave for people who, may struggle really badly with different types of things, not just for periods, but, if they have endometriosis or PCOS. Do you see us going down that road in the future?
Look, we would like to see, something legislatively put in place for this. But you're right. This is going to not be a sprint. This will be a marathon, I would say. We're in very early days. We're having a conversation about awareness raising and trying to break the stigma. That's the first step. Getting the workplace policies in place where there's a culture that employers will have a conversation about this is the next step. Certainly, we would be looking for within our policies some kind of guidance around, people maybe having special leave if they had a medical condition. I don't think Ireland is in a position to legislate for that yet. I know that, the Minister's Department has commented on that during the Stop the Stigma campaign, that they're not in a position to do something on that yet. But having said that, Spain do have, and they were the first country to come out and have a look at this. And, they're very tight restrictions even in Spain. Like, people think because this period leave in Spain that it's ad hoc and every woman gets this every month. It's certified leave and it must be a medical condition. So it's not like it's a kind of a
every month kind of thing. Yeah.
Everywhere, okay. And there's places like South Korea and Australia and stuff that has similar. But look, as I said in the beginning, there's countries doing stuff around this, and it's been very little done in the Republic of Ireland and Northern Ireland yet. And I suppose we're trying to grab the mantle and take this forward now. We have had conversations with the Irish Congress of Trade Unions, where they're very much on board with the Stop the Stigma campaign too. So we are now trying to pull in other unions, affiliate unions of Congress, so that they can, start seeking workplace policies within their sector as well around menstrual health. So we've had conversations with some employers already, and won't name them because, the policies aren't in place as of yet. But we have had conversations, and what we're being told by employers is that you're kicking an open door.
Okay.
So this is something that people do want to have, good employers do want to have a discussion about.
Okay, Mandy La Combre, Senior Industrial Relations Officer with the Financial Services Union. Thanks very much, Mandy, for joining us today. And do let me know if you'd be comfortable talking to your boss about having your period.